Diabetes neuropathy often attacks feet. Unfortunately, sometimes people lose toes, feet, or even more. In this conversation, Dr. Kelly talks about how to avoid amputations, what to expect when an amputation is necessary, and how to take care of your legs post-amputation.
Diabetes sucks.
But at Simply Diabetes, we can help you manage your diabetes cheaper and easier.
We are not medical professionals. We are people with diabetes, just like you.
Welcome. So if a person is too far gone to prevent or has multiple infections and it leads to them needing to have a foot amputated, what leads to that? What makes it get to that point?
Why does someone have an amputation? And I understand amputation has different levels. You can have a toe amputation. You could have multiple toes. You could have part of the foot. And then if this part of the foot is done, then really the next level is below knee or above knee. Wow. And this has a lot to do with the circulation, meaning that how the pipes come down and bring the supply. You cannot just amputate at the level of the infection. You have to amputate at the level that once you remove the infection, the stump will heal. Mm-hmm. So you cannot just go, oh, this is the level, I'm just going to chop it up. No. So why would someone have an amputation? When there is an injury, this is why doing a daily inspection of feet, it becomes really important, especially if you have neuropathy. Every night, take your socks off and look at your feet. If you are unable to look at your feet, have a loved one look at it. And if there isn't anybody, you live by yourself, get a mirror with a long handle, stick something, and literally look on the bottom of your feet. Look for any redness or cuts or anything that is unusual to you. First, have your baseline, know what it should look like, and then you can use that to check your feet. Now, let's say you forgot to check your feet for a couple of days, and then you took your sock off, and you saw this tack stuck on the bottom of your foot, and you pull it out, and there's redness, and it doesn't look very good. Well, what happens is that now you have had an injury to the skin with an infection for a few days that has gone unnoticed. That infection has gone into your skin. And if you had waited maybe longer, it may have gone to the bone, okay? If it does go to the bone, then it's very, very, very difficult to treat an infection in the bone with antibiotics. We can put you on 6 weeks of antibiotics with the ports and all sorts of things and hope that the infection will resolve. But most of the time, the infections in the bones are difficult to resolve with the antibiotic. And so what happens is that you have to remove the bone. And as part of the removal of the bone is what the amputation comes in. Because
that's pretty
otherwise,
drastic.
Because the infection is not going to heal, and then you will just have a constant just being sick. And of course, it's something that infection has to be resolved. You cannot let it go. It will take over your body if you don't.
Yeah. One of the other things you could do if you don't have a loved one and you can't reach, buy yourself a selfie stick and take a picture of your foot.
Yep, that is another one. Okay. Absolutely.
Okay. Taking care of your feet after amputation.
Oh, obviously, you know you're at risk. So daily inspection, following a diabetic prevention protocol, checking your feet, making sure that you moisturize your skin, make sure that your shoes are padded. You can get diabetic shoes with specific inserts meant for people with neuropathy. And if you have a below knee amputation, then you don't have to worry about taking care of the feet. It's gone. Now you have to take care of the stump.
Right.
So
if you do have an amputation of a toe, does that impair your balance later?
If it's your big toe, absolutely, because your big toe is the engine of the foot, and the lesser toes are not as big of a deal. But the big toe is a must. In the world of podiatry, all the efforts are to save the big toe, because that is the one that drives a lot of propulsion and moving forward. So we need to keep it good.
Okay. Is there anything else we need to know?
Keep your sugar under control, number one. That means if you have to check your sugar daily. Number two, know your hemoglobin A1C, because that is your report card for the past 3 months. If you go to a doctor and they ask you, what is your sugar level, what is your A1C, and you only have your daily, that is not good enough, because that's only a snapshot of a very short period of time. Your A1C is your report card, because no matter how much you try to convince or cheat yourself to get a better number, that A1C will never lie.
Absolutely bang on. Is there anything else diabetes should know about foot care that we haven't covered?
Go get your feet measured to make sure you're wearing the right size shoes. Many people wear the wrong size shoes these days, and they all think that, oh, I was 21 and my size was 10 and I'm 81 and I should still be size 10. We don't know. Get your feet measured periodically, because shoes make a huge difference in a diabetic patient with the cuts and bruises and nail injuries and things that can be shoe related and can lead to amputation.
Okay. I have a personal thing on that. My sister, who just passed away last year, had the wrong shoes when she was little. We were very poor, and one of her toes
overlapped,
bent over the other. It was horrible. I feel so bad for her. So if I can end with this, if you want to take good care of your feet, put them in the hands of a good podiatrist.
Thank you.
You can use that.
I'm here. Happy to help and educate patients. Each question can be opened up and expanded on, and they don't have to be huge. But the world of diabetes and foot is this is a multi-trillion-dollar costly thing to our country. We can educate people with just small little bits of things, as simple as how to trim your toenails.
So if after people watch this and they have questions about podiatrist or their feet and diabetes, can we ask them to send us the questions and we can follow up with you?
Absolutely. I love prevention and I love education. And
as we've seen today. If you find this information useful, give us a like, subscribe to the channel, and tell your friends about us.